เห็นครับอาจารย์
Okay. The topic today is research question and hypothesis. So it is the first topic for this course because it is the very beginning of any research project. We start with research question. And this slide summarizes the content of this lecture today. So I will cover the definition and characteristics of research, steps that we need to take in research process. And we will go into details about research questions and hypotheses. And I would like to introduce some common categories of research questions in health science and how to develop proper research questions, and a little bit of overview of study designs. The details of study designs will be the subsequent topics in this course. So let's start with the definition and characteristics of research. I think most of you will have some experience about research, and maybe you use the research in your study, in your clinical practice, or maybe some of you may have participated in some research. So I think you can perceive what a research is, but however, there are people who define research. In some occasions, it might not be quite clear whether a project is actually a research project. There are some activities, some projects that might not be a research project, but some might misunderstand that it is a research project. So we need to be clear what a research project is. So there are various definitions of research, and I will give you just some examples. A research is defined as a process of solving problems and resolving previously unanswered questions. Another definition, a research is a scientific approach of answering a question, solving a problem, or generating new knowledge through a systematic and orderly collection, organization, and analysis of data. A research is the creation of new knowledge and or the use of existing knowledge in a new and creative way so as to generate new concepts, methodologies, and understandings. Another one, a research is a creative and systematic work undertaken to increase the stock of knowledge. So these are just 4 examples of various definitions of research, and there are many others. You'll notice that they are not exactly the same, but you will notice that there are some common themes that these definitions are built on. For example, you will notice the words questions in the definition of research. So that's why we have this first topic about research questions. There must be questions before we can go on to research. And you'll notice that there is the word like knowledge, new knowledge. So why do we need research? The ultimate goal, the utmost important objective of research is to discover new knowledge. It might be a description of a new phenomenon, a definition of a new relationship, development of a new model, or even application of an existing principle or procedure to a new context. So there must be some newness of the knowledge when we do research. So we need something new. And that's very important because if there is nothing new about your project, that might not be considered a good research. And a research should process these characteristics. The first characteristic is that research must be systematic. The whole process of doing research must be systematic. A research has to be performed purposefully through structured activities. So there are rules that we need to proceed, we need to follow. The processes must be systematic and structured. We have to know about methodology of research, and then we will have the research plans or research protocols before we actually conduct the research. So it must be systematic. It must be planned in advance. Research follow some logical pathway, logical reasoning. Research employs logical reasoning. Many logic are used in research. The most common ones would be inductive logic and deductive logic. There are others logic that can be used in research, but these two are the most important ones. The inductive logic, in inductive logic, we develop a theory or hypothesis based from observations. Observations are the basic activities of research. We make observation, and then we develop a theory or hypothesis. And this is the inductive logic. And for deductive logic, it's the opposite. We have a theory or hypothesis, and then we test those theories or hypotheses through observations. So let me explain you a little bit more about these two logics. This diagram represents the inductive logic. So we have specific observation, and then we recognize some pattern, and then we formulate theories or hypotheses. Many descriptive research follow this logic. For example, in the past, before we know that cholesterol is the cause of heart disease or cardiovascular disease, scientists or clinicians in those days observed that people who succumb of cardiovascular disease, most of them had higher cholesterol than people who do not have cardiovascular disease. So this was the observations, and this pattern of correlation or relationship between cholesterol and cardiovascular disease was observed consistently in the past. Whether they observe it in any countries or in any region, in any institution, by any researcher, they observe the same thing. So they recognize the pattern that there is a relationship between cholesterol, serum cholesterol, and cardiovascular disease. And then they formulate the hypothesis that cholesterol might be a risk factor or a cause of cardiovascular disease. So these research follow inductive logic. And for deductive logic, we have the theory first, and then we collect data we analyze data, and we accept or reject the hypothesis. Many research in the field of medical science follow this logic. For example, I will follow through the cholesterol example. When the hypothesis about relationship between high serum cholesterol and cardiovascular disease was formulated, then that is the hypothesis that we have. Then later research try to prove this theory or hypothesis by following deductive logic. So researchers collect data regarding serum cholesterol and the incident cardiovascular disease, and then they analyze data to see whether the correlation or relationship between cholesterol and cardiovascular disease support the hypothesis, the existing hypothesis generated from previous observations. And then they accept that this relationship is correct, and cholesterol should be the risk factor or cause of cardiovascular disease. So these are two logics frequently used in research, especially in medical science. The third characteristic of research is that research is empirical. Empirical means that for research, we put more emphasis on observations or data, because data is related to reality. What we observed, we believe that that's correct. So personal experience is less valued than data in research. We believe data more than personal experience. And if there is a conflict between data and hypothesis, if they don't fit in with each other, we will discard the hypothesis, not the data, unless it is very clear that the data are flawed. So if we don't have evidence that the data are severely flawed, and if the data contradict with the hypothesis, we believe that data are true. So hypothesis must be wrong. That's empirical. We put more emphasis on data. The first characteristic of research is that it's reductive. For research, we are reducing the confusion of individual events and objects to more understandable categories of concepts. When we conduct research, we collect data, we collect information. We have many variables, and for each variables, we have many values. So these values are confusing. We cannot make any sense if we look at each particular value in each particular variable. So we need to summarize them. We have to reduce them from numerous numbers to just some few numbers that we can make sense of the data. So from individuals' data, we need to summarize them into group using the process of data analysis. If we have a variable, for example, blood pressure is a variable in research. We collect blood pressure from subjects. So we may have many hundreds or thousands number of blood pressure. And if we look at each particular number of blood pressure, we cannot make any sense of them. So we have to summarize them. We get some few numbers, for example, the mean blood pressure in a group with the standard deviation. So it's reductive for research. The fifth characteristic is that research must be replicable and transferable. For research procedures, they they should be well documented in details. For example, we have research protocol, which will give details about a research process. So it is possible that when a research is distributed, other team of researchers can replicate this research in order to validate, maybe to confirm the finding, the conclusions, or maybe to refute the conclusions. So it has to be replicable. We need a process to ensure that any research could be replicable. And research should be transferable. Transferability enables the general body of knowledge to be extended by subsequent investigations based on research. When we do a research, we have the conclusion, then we should transfer this knowledge to other people so that they can continue, they can further the knowledge, they can extend the knowledge. So when we do a research, when we get the results, it's our obligation that we need to disseminate the result as soon as possible for others to replicate or to extend on that knowledge. The last characteristic of research is that it must contribute to a generalizable knowledge. This is very important, and it will help you differentiate activities that may not be clear to you, whether it's a research project or not. For example, if you have a quality improvement project, superficially, it might look like a research project. There are some similarities for a research project and a quality improvement project. They involve gathering data, they involve summarizing data. But the main difference is that for a quality improvement project, it doesn't have any intention to contribute the knowledge, to generalize the knowledge. But for a research project, it must has the intention to contribute the knowledge, to generalize knowledge. So this one is the intended objectives of research. For any research, we need to extrapolate findings from a sample to a larger population to define some universal truth. So we don't stop just in the sample. We need to infer to the population. For quality improvement project, we stop just at that sample. We know the answer, we know how to solve the problem in that particular situation. We don't have any intention to generalize that knowledge to other situations. So that's different from a research. Our next topic will be the steps that we take in research process. This will be a summarized one. In details, you will study in the subsequent topics in this course. So when we will do a research project, what process that we need to follow? We have to first identify the problem areas, the areas that we are interested in. We would like to do our research on this area. So we need to identify this, and it depends on your interest. It depends on your field of expertise. It depends on your work. Different researchers will have different interests, so they will have different problems, but each of them need to identify what the problems are before they conduct the research. And when we know what the problems are, then we review literature to gain more information, to gain more knowledge, and to identify the knowledge gap. Knowledge gap is something that we still don't know. So we review literature in details to determine what is already known and what is still unknown, and that is the knowledge gap, and that will be the issue that will generate research. And when we know the knowledge gap, we would like to fill this gap. We would like to answer the unknown, the question that we don't know the answer. We have to answer that through research project. Then we formulate the research questions and this research hypothesis. And this is the topic of today. Then after we have research questions and hypotheses, we will identify all relevant variables, the variables that we need to study in the research. We need to construct the operational definitions of those variables. What do we mean by those variables? How do we define them? And how do we measure them? What measurement tools we are going to use to measure those variables? We have to think about this. Then we develop a research plan, research protocol, and analytic plan, the statistical plan, how we are going to analyze data. And this is very important. The plan will tell you what you are going to do in your research. And if this plan is well documented, if it is well kept, then it will be the basis for other researchers to replicate your research. So we need to have a very good, a very detailed plan. So after that, you'll go through the process of ethics committee approval, and then you will start to collect data. Sorry, you have to design data collection plan. And this might be embedded into the research protocol as well. And then you collect data and process data. You clean your data. Then you conduct data analysis as planned in the research protocol. You draw conclusions related to the research questions, what the answers to those questions are. And then finally, you prepare a manuscript to distribute the research finding for other people to use this conclusion to generalize your finding into broader situations, and for others to be able to extend on your research, or maybe to just confirm your research. So these are the summaries of the process involved in research. From the beginning, from identifying the problem area until we get the result, and then we get publication, we generalize, we distribute the knowledge, we generalize the knowledge. So there are many steps that we have to take. Okay, next topic will be the main topic of this session, research questions and research hypothesis. Now we know what a research is. Next, we may ask, what is a good research? What properties should a good research has? Some experts, some methodology experts wrote in a paper many years ago. This is the reference if you are interested in that. A good research has two parts. The first one, a good research has to ask an important question. So a research starts with a question. If the question is important, that is the beginning of a good research. Then the second part of a good research is that if a research has a good question, it has to provide a valid answer to that question. I emphasize here that we need a valid answer to the question. We just don't need any question. So, sorry, we don't just need any answer. We need a valid answer. The answer that represents the truth. We would like our answer to the research question to be true. So for any research, it is very important that it should has validity. And by the word validity, I mean the extent to which the research result represents the truth. So we have a question in the research, and then through the process that I described to you, we get the answer. We would like this answer to be the truth to be true. But however, in any research, when you get the results, there are two components mixed in your results, always two components: the truth that you would like to know and the error. We would like to know what the truth is, but there will be some error mixing together in your research results. So we need to understand this concept, the error in research. And for error is something that will deviate the research result from the truth. It will make results not corresponding to the truth. There are two types of error in research. The first is random error, and we know it in the name of chance, ความบังเอิญ random error. And the second type of error is systematic error. We know it in the name of bias. So these are two errors that we have to consider when we look at the research results. These two types of error are different. For random error, there are sources of variation that are equally likely to distort the results in either direction. So for random error, it might overestimate the results. The results must be greater than the truth. But in some occasions, the random error might also reduce the research results, making it less than the truth. It might underestimate the results. So random error doesn't have any particular direction. It can either overestimate the result or underestimate. It can be in either direction. It happens at random. But for systematic error, there are sources of variation that distort the results in one particular direction. So for systematic error, there is direction. If we have this type of error that overestimate the results will be greater than the truth. If that kind of research is repeated again, it will again overestimate the result. It will always overestimate the results. In some research, it might some other research, it might underestimate the result. But if the research is repeated again and again, it will always underestimate the result. So these are the difference between these two types of random error. They happen at random. They don't have any particular direction. They can be either over or underestimate. But for systematic error, there is particular direction. And we have to understand this because in order to get the results that represent the truth, we need to eliminate or minimize error. And the procedure that we use to minimize random error is different to that we use to minimize systematic error. We use different procedures to minimize these two errors. So we have to know the difference between the two. So validity of research. We would like the result to represent the truth. There are other two terms regarding validity that you need to know, because you might have seen it or have heard it in the textbook or in literature. There are two types of validity: the internal validity or accuracy, and external validity or generalizability or practical utility. I will explain to you how they are different using this very important diagram. This diagram will explain you the function of research. How we can use research to get the knowledge that represents the truth. Okay, I will try to explain to you in details regarding this diagram. So when we conduct a research, we start with knowledge gap, something that we don't know. We transform that knowledge gap into research question. We have a question, we don't have the answer. We would like to do research to answer this question. And the research question will pertain to some particular population. We have the target population and some phenomena of interest. For example, we might have question about the prevalence of some disease in a population. For example, we might ask, what is the prevalence of high blood pressure or hypertension in Thai population? So the target population is people in Thailand, and then the phenomena of interest is high blood pressure or hypertension. So this will be the research question. When we have the research question, the answer of this question will be the truth in the universe, something that we don't know. Because if we know this truth, then we don't need a research, right? We need a research because we don't know what the truth is. We would like to know it. There will be an underlying truth, the true answer for this question. From this question, we design our study. We have a study protocol, the study plan. This is what we plan to do with the research. We have intended sample that would represent the target population. We have intended variables that would represent the phenomena of interest. And when we have the plan, we get approval from ethics committee, we conduct our research. And when we conduct our research, things might not follow the plan. So we get actual study. Some part of these processes might not follow the plan. So from the intended sample, we get actual subjects that we have in the research, in the study. From intended variables, we get actual measurements. So this is what we have when we finish our research. We analyze data. We get findings in our study. So this finding, we hope it represents some truth. And from this finding, we infer that this finding would represent the truth in the study. And the truth in the study would represent the truth in the population or truth in the universe. So you'll see that in the process of research, we start from the population. And then when we actually conduct the research, we get the sample. We analyze data, we get the result from that sample. Then we infer this result back to the population. But along the way, from question through actual study, there might be some error occurring through the process. So when we design the study, there might be some random and systematic error happening through this process that will make our study plan to not correspond to our research question. The intended sample may not represent the target population. The intended variables may not represent the phenomena of interest. And from the plan, when we actually conduct the study, we get actual subjects which might not fully represent the intended sample, and we get actual measurements that might not fully represent the intended variables. There might be some error occurring in this process. And if we have error in this process, then we make inference back from findings in the sample back to the population. It will not represent the truth. So from study plan to actual study, if we have error here, then we have problem with internal validity. So internal validity concerns about study plan, the plan that we have, and actual study, whether we get something that according to the plan that we planned in the beginning. So this is the process. This is the step that we are dealing with internal validity. But from question to plan, the design process, this is the issue of external validity. The plan that we have will not represent the target population. So this is the difference between these two types of validity. Internal validity will be the issue from the plan to actual conduct of the study. But for external validity is the issue regarding whether our plan represents the underlying population. So from this diagram, you can see that if you want your research result to represent the truth, we will be able to infer from findings to underlying truth in the population. We need to minimize or eliminate all these random and systematic errors. So for a good research, in order to provide a valid answer to the question, we need to design and implement the study in a way that minimizes errors, both random error and systematic error. So we will get a valid answer, the answer that represents the truth. And how to design and implement the study in this way will be the subsequent topics for this course. But for this topic, we are dealing with the first one, ask an important question. So I will go into details about research question. And I will leave this to the subsequent topics that we will learn later on in this course. What is a research question? A research question is the uncertainty that investigator wants to resolve by performing a study. Why do we need to emphasize about research question? Actually, in the history of mankind, in terms of knowledge acquisition, inquiry of knowledge, human beings emphasize question for a long time. And this can be reflected in some words from previous philosophers, previous academics. For example, if you look at this one, judge a man by his questions rather than by his answers, by Voltaire, a French writer in the past. So you'll see that people in the past, and not in the field of research, human beings emphasize question rather than answers. A prudent question is one half of wisdom, from Francis Bacon, an English philosopher. Again, if the question is good, that represents half of human's wisdom. It is not the answer which enlightens, but the question. From Eugene Ionesco, a French Romanian playwright, again emphasizing the importance of question. Question is maybe more important than answer. And in the field of research, why a research question is important? Because research question dictates almost every aspect of research. What you are going to do with your research will be determined by your research question. Almost all aspects of them will be determined by research question. For example, research question will dictate your study design. What design that you are going to use in your research depends on your research question. Different questions will require different research design. Research question will determine your eligibility criteria. Which subject that you will enroll into your research project will be determined by your research question. Research question will determine study procedures. What you are going to do with your subjects. What variables you are going to measure, when you are going to measure them. All these are determined by research question. Question determines the outcomes. What outcome? Which variables that you are going to use as your outcomes? This again is determined by your research question. Research question determines statistical analysis. When you want to analyze your data, which statistical procedure that you need to use to analyze data will be determined by your research question. And follow that. How many subjects you need in your research project? How big should your sample size be? Will be determined by your research question. So question determine everything in research. Then it is very important that you have a good question at the beginning before you conduct a research. Okay, so we need a question. But when you are thinking about doing a research, it is very common that you will start with some topic that you are interested in. If you are working in the field of, for example, in the field of, for example, dengue virus, for example, you are interested in dengue virus, then you might want to do research about dengue virus. So this is the initial interest in your research. This is still not a research question. It's just your interest. There is no question at all. And from this interest, you may be you may suspect, or you may have some particular question at the beginning, and this question may be still broad, general, or it's still ambiguous. It's not clear yet, but it's the beginning. And from this beginning, you need to refine you need to modify your initial interest or initial question into something that you can use as your research question. And for a research question, it has to be specific and it has to be clear. So from this initial point, your interest, until you develop your research question, you have to go through this long way. And what this long way encompass? It encompasses many activities. The process of refinement and modification of your research. You have your interest, you have your initial question that might still be broad, might still be too general, might still be ambiguous. You review literature, you gain more knowledge, you gain more information. You consult with your mentor. You discuss your idea with your friends, your colleagues. You get additional input from this process. Then you refine your question, make it more specific, more clear, and eventually you will get your research question. This process is iterative. It will occur in circular. So you have interest, you have initial question, you gain more information through literature review, discuss with your mentor, your colleagues, with your friends. Then you refine your question, you get more knowledge from additional review of literature, discuss with your colleagues, your friends, your professor again. Then you will have a new version of your question, and then you repeat it again and again until you get the final question that you think this is the one that you're going to follow as your research, the one that is specific and clear. And it represents the true knowledge gap. And it is important. And this process takes time, not days, not weeks, maybe years. For some big research project, this process alone takes years before they can get a good research question. So don't be hurry about research. You need time, you need resource. Okay, so many of you now may already have this topic or idea in your thought. This is what I'm going to do as my research. But to get a true research question, you need to make it specific and clear. Why do we need a research question that is specific and clear? Again, the specificity and clearness of research is clearness of a question is important. Since the past, a problem clearly stated is a problem half solved, from Dorothea Brande, an American writer. So if we can define our problem clearly, it's equivalent to that you have half of your answer solved. Sorry, you have solved half of your problem. You already have half of the answer. By the same token, in the field of research, a research question clearly stated is a question half answered. If you have a clear and specific question, it's equivalent to getting half of your answer. When you have a question, you need to make it clear and specific. How can we do that? How can we formulate a clear and specific research question? In the field of research, we do this by clearly specifying each component of a research question. And research question in medicine, many of them are dealing in clinical practice. So this idea developed based on clinical research question, but it can also be used in other area of research question in the field of health science. It can be modified or adopted in laboratory research question as well, or animal research question. So it might not have to be clinical, always clinical, but you can use this same principle when you are developing your research question, whether you are working in the field of clinical research or animal research or basic laboratory research. We have the same principle. So these are the 4 components of research question in terms of clinical research question. We know it by the acronym PICO, P-I-C-O, PICO. P represents target population. Who is your target population in your research? I and C will be considered together. I, intervention. In the field of clinical research, many of them are dealing with the treatment of people, treatment of the sick, or prevention of disease. So I, intervention mean those interventions that we can use to treat disease or prevent disease. But in other field of research, it will be some factors that you are interested in. So I here maybe some exposure to some chemicals or some environmental factors that might cause disease. It's the same principle here. C, comparator, comparison intervention. If you want to study the effect of intervention on your target population, you need to compare it with something. For example, if the intervention is a new treatment, you would like to know whether it's effective or not in treatment of a disease. We have to compare it with some comparator, like no treatment or other kind of treatments, for example. Or if your idea is the exposure to some chemical substance that might result in cancer, for example. You have to compare it with no exposure, for example, the condition that will be used to compare it. So C is comparison intervention or comparative. And we need to consider these two together because in many occasions, they are the same thing. They are the same variable, but we will have different level of exposure to compare between them. And the is the outcome. Outcome is something that we expect that it will change in subject as the result of this intervention or exposure. So if we can identify these 4 components of research, and then we make each component specific and clear, you will get a clear and specific research question that will be the basis for all aspects of your research. I will give you an example here. Suppose that you are interested in meditation, and this is your initial question. What are the effects of meditation? This is still not a good research question because it's not clear, it's not specific. It is just a research topic or idea. You are interested in meditation. What effects it will produce? But this question is still broad and general, and is still ambiguous. It's ambiguous in many ways. For example, are you focusing on which population are you focusing? about this meditation. It's meditation in children, meditation in older people, or meditation in general population, or meditation in some in people with some disease. So it's not clear here. It's still ambiguous. What age, what sex, what disease. And for this meditation, how is it performed? There are many types of meditation. Which one are you interested in? And how often is it performed? For how long? It's still not clear here. And for the effects here, what are the effects of interest? Are you interested in what? Sleeping quality or productivity or what? So what are the effects that you are interested in? And how and when to measure them? And you can see that these are just some examples of ambiguity about this initial research question, still not a good one. So we have to refine this question to make it more clear and more specific. So you begin with reviewing your literature. So you go to literature, you will obtain knowledge about types of meditation, the previous knowledge about effects of meditation on human beings in many aspects. And then you refine your question. You might come up with this one: effect of meditation on blood pressure among subjects with high blood pressure who have not taken blood pressure medication. So now it's more clear that you have the idea about the population that you are interested in. People with high blood pressure who have not taken blood pressure medication. You have clearer idea about the effect. You want to know the effect of meditation on blood pressure. Now it's about blood pressure. But still, it's not very clear. For example, you are still not clear about meditation. What kind of meditation? So you have to go on further refinement. Repeat the cycle again. More review of literature. Discussing with your colleagues, your professor, your peers. Make it more clear, more specific, until you will get something like this. You have to specify each component. So regarding population, make it specific and clear. Your target population might be men and women aged 30 years or older with grade 1 hypertension, which needs definition. What is grade 1 hypertension? And currently not taking any antihypertensive medication. So there are people with mild degree of hypertension that still that do not still need medication. So now it's quite clear who is your target population. And for eye intervention, you are interested in meditation, but you have to specify the intervention, which type of meditation you are interested in, and the details of performing this type of meditation. So it might be a meditation type called mindfulness meditation, performed 15 minutes per session, performed 2 sessions per day, and performed continuously for 3 months. Now it is clear what intervention you are interested in. You may have to make it more clear regarding your mindfulness meditation, how it is performed. So you have to put into more details. So mindfulness meditation is performed by sitting with eyes closed, cross-legged on a cushion or on a chair with the back straight. Focus on the awareness of the breath as it goes in and out of the nostrils. This is mindfulness meditation. So you have the details. And in order to perform this type of meditation, subjects will have close supervision during the first week. So then they don't just read the book how to perform mindfulness meditation, but they will be supervised during the first week, and then later on they perform this type of meditation by themselves. And this intervention, mindfulness meditation, is add-on to advice for lifestyle modification. For people with high blood pressure, it is mandatory that you provide lifestyle advice regarding lifestyle modification. So this is a basic treatment that people receive, and then you will add on mindfulness meditation as your intervention. So we have P and I. They are quite clear now. What about C? Control intervention. Mindfulness meditation compared to what? So obviously it's compared to not performing mindfulness meditation, right? So it's comparing to just advice for lifestyle modification alone, no mindfulness meditation. And for the outcome, what would be the effect of interest? You are interested in blood pressure, but how you are measuring blood pressure? You have to specify this. So you will take the average blood pressure obtained by means of a device, a 24-hour ambulatory blood pressure monitoring device at the end of the 3-month period. So now you have all 4 components. They are all now quite specific and clear. And then you put them together to formulate your clear and specific research question. The general format of research question is: in population P, what is the effect of intervention I or the outcome O compared to control C? You can use this format. So in the population P, in individuals aged 30 years or older with grade 1 hypertension without antihypertensive medication, thus intervention, mindfulness meditation practiced for 15 minutes twice a day for 3 months, in addition to lifestyle intervention, reduce the outcome, reduce the average 24-hour blood pressure at the end of 3 months period compared to control, compared to lifestyle medication alone. Now, this research question is now clear and specific. It contains all 4 major components of your research questions, and each component has details. And this will serve as your research question that you can build on other aspects. And now from this clear and specific research question, you can develop your research. If you are clear about your question, you will know easily which design you are going to use. You may not have knowledge about study design in details now, but I think you may have some idea about research or study design. Right? So here we are going to study the effect of meditation intervention on some clinical outcome. And later on in this course, you will know that for this type of question, the best design that would provide the correct answer for this type of question should be experimental study, the randomized clinical trial. So you will have your study design as randomized control clinical trial. From this research, you can define the eligibility criteria of subjects. Which subject you will enroll into your study. You need people aged 30 years or older with grade 1 hypertension. And there is a definition for grade 1 hypertension with systolic blood pressure between 140 to 160, and diastolic between 90 and 100. So this is grade 1 hypertension. Who doesn't have doesn't take any medication yet. So this is the main eligibility criteria for your study. You will determine the study procedures. From this research question, you will know what variables that you are going to measure. And you will know what you are going to do with your subjects. When you enroll a subject, you will measure the blood pressure. You will teach them how to perform mindfulness meditation. You will advise them about lifestyle modification. You will follow them for 3 months. At the end of 3 months, you will provide a 24-hour blood pressure monitoring using a device. This will be clear from the question, the procedures that you need in your research process. Outcomes will also be determined by this question. Here it's clear that you have the blood pressure at the end of 3 months as your outcome, right? So the outcome would be average 24-hour blood pressure at the end of 3 months, and you know how to measure this outcome using a device. In terms of statistical analysis, how you are going to analyze your data to answer this question. Here you will have 2 groups of people. One who perform mindfulness meditation, the other who doesn't perform mindfulness meditation. You'll take their blood pressure at the end of 3 months period. So each individual will provide you a number of blood pressure, and you will have the summary measure of your outcome for each group. You will have the mean blood pressure at the end of 3 months, mean blood pressure for mindfulness meditation group, and mean blood pressure for a control group. And to answer whether mindfulness meditation have any effect on blood pressure, you have to compare these 2 means. You will compare the mean of blood pressure in the control group with the mean blood pressure in the mindfulness meditation group. So you will know that you are comparing 2 means, 2 independent means. And for statistical approach that we use to compare 2 independent means, if you have some knowledge about basic statistics, you can tell that we are going to use independent t-test to compare 2 means, 2 independent means. And follow on that, how many subjects you need for your study, the sample size. If you know how you are going to analyze your data, you will compare 2 means using t-test. Then you will calculate your sample size based on t-test. There is a formula for sample size calculation based on t-test. There are actually many sample size calculation formulations. You have to pick the right one. You can pick the right one if you know how you are going to analyze your data. If you know that, you will pick the right sample size calculation procedure or formula. So these all aspects are dictated by this specific research question. I'll give you a hint here. A specific research question is usually close-ended. If you are not sure whether your research question is specific or not, consider whether it's a closed-ended or open-ended question. A specific research question is usually closed-ended. A closed-ended question is the question that have only 2 possibilities of answer, yes or no. Open-ended question is a question that the answer can be whatever, not just yes or no. Consider this one, this question, what are the risk factors for stroke? It can be a research question, but this question is an open-ended question because the answer can be anything. What are the risk factors for stroke? The answer may be smoking, age, high blood pressure, high cholesterol, alcohol. So many possibilities of answers. So it is not specific. It is still not a specific research question. Compare this question to this one. Is high cholesterol a risk factor for stroke? Now, this question, the possible answer can be just yes or no. Is high cholesterol a risk factor stroke? Yes or no. It cannot be anything else, just yes or no. So this is a close-ended question. This is a specific question, and it can be used as a research question. So if you begin with this type of question, what are the risk factors for stroke? You have to refine this question until you get something like this. Is high cholesterol a risk factor for stroke? Is high blood pressure a risk factor for stroke? Is smoking a risk factor for stroke? And so on. So you may end up have many questions that you want to answer. There is one exception for this hint. If your research question is related to the states of nature, the status of something, then it has to be an open-ended question by default, because this type of question cannot be made a closed-end. For example, look at this question. What is the prevalence of hypertension in the elderly? This is the question related to the states of nature. We would like to know the fact, the status of hypertension in the population in the elderly. What is the prevalence of hypertension in the elderly? The answer can be anything like 5%, 10%, 20%, 15%, or whatever number. They are all possible. We cannot answer this question by yes or no, right? So this is the type of question that is an open-ended, but we will consider this a specific one. Okay, now you know how a clear and specific research question look like. When you get your research question, you can determine your research objective and your research hypothesis. Actually, these three things are closely related. They are closely related. I will show you in the example that they are actually the same thing: research question, research objective, and research hypothesis. For a research question, it is the four components PICO presented in a question sentence. Look at this example. In patients with type 2 diabetes, does aspirin 75 milligrams per day reduce the risk of cardiovascular death, myocardial infarction, or stroke when compared to placebo? This question has all four components. The P in yellow, target population, patients with type 2 diabetes. The I intervention in blue, aspirin 75 milligrams per day. The C comparator in green, placebo. And the O outcome in pink, cardiovascular death, myocardial infarction, or stroke. So they have all four components. And these four components, PICO, are presented in research, in a question sentence format. So you have a question mark here. This is a research question. And from this research question, you can transform it into a research objective. So research objective is actually the rephrasing of research question as the objective of the research in an affirmative sentence. ประโยคบอกเล่า So you can, from the previous research question, you can write your research objective like this. The objective of this study is to demonstrate the effect of aspirin 75 milligram per day on the risk of cardiovascular death, myocardial infarction, or stroke in patients with type 2 diabetes mellitus when compared to placebo. And I put when compared to placebo in parentheses, because in many occasions we can leave this out. We may not write this, but we imply that we are comparing aspirin to something. And you can see that this is the research objective, which also contains all 4 major components of the research question, the PICO. And what about research hypothesis? Research hypothesis just predict the answer to the research question. So you have the question, what is the expected answer? What is your prediction regarding the answer to that question? That is research hypothesis. So based on the question regarding aspirin to prevent cardiovascular death, MI, or stroke in patients with type 2 diabetes, how can we write the research hypothesis? So we have to predict patients with type 2 diabetes. They have a greater risk of getting cardiovascular disease, and we expect, or we hypothesize, that aspirin might be able to reduce those risks. So research hypothesis is the prediction of your answer. So we hypothesize that aspirin 75 milligram per day can reduce the risk of cardiovascular death, myocardial infarction, or stroke in patients with type 2 diabetes mellitus when compared to placebo. And again, I put when compared to placebo in parentheses, because we can leave this out when we write research hypothesis. And again, you can see that for research hypothesis, you have all 4 components, PICO. I would like to explain more about research hypothesis in order to avoid confusion with another type of hypothesis, the statistical hypothesis. Research hypothesis and statistical hypothesis, they are related, but they are not the same. Statistical hypothesis, you learn this when you study about basic statistical procedure that we use in data analysis. The approach of hypothesis testing, when you want to test hypothesis using statistical tests, you will have the null hypothesis and the alternative hypothesis. Those 2 are statistical hypotheses. They are not research hypotheses. So when you develop your research protocol and you would like to specify your research hypothesis in your protocol, do not use statistical hypothesis. Research hypothesis is the expected answer to your research question. You expected that aspirin will reduce the risk of cardiovascular event in patients with type 2 diabetes. But when you analyze data, you will have the statistical null hypothesis, which will state that aspirin will not reduce the risk of cardiovascular event in those patients. That is the statistical null hypothesis. You will see that statistical null hypothesis is in the opposite direction with the research hypothesis. In research hypothesis, you state that intervention will have the effect on outcome. For statistical null hypothesis, you will state that the intervention will not have any effect on the outcome. So when you write research hypothesis, do not use statistical null hypothesis as your research hypothesis. They are in the contrary. Okay. Now you can see from the previous 2 or 3 slides that research question, research objective, and research hypothesis are closely related. They convey similar information. The P, the I, the C, and the O will be presented in all three forms of statements, whether it's research question or objective or hypothesis. So if you have question, then it will be very easy to get research objective and research hypothesis. Now let's talk about research question in health science in more details. For research questions in health science, they can be categorized into groups. In the broad sense, there are two broad groups in terms of research question category in health science. The first group will be research questions related to states of nature, descriptive research. Just describe what is going on, what happens. Descriptive research. And for this type of research, there will be no specific hypothesis. This is the type of research that you will not write research hypothesis because there is no hypothesis. You just want to know what the states of nature is. What is the prevalence of hypertension in the elderly? You don't have any hypothesis. You just want to know what is the prevalence. But for another type of research questions related to relationship between variables, analytic research, this research will have specific hypothesis regarding the relationship. Thus, aspirin 75 milligrams per day reduce the risk of cardiovascular disease in patients with diabetes. Hypothesis, it reduces. You have hypothesis. It's analytic research. So there are two broad types. And from these two broad types, I will subdivide them into more specific categories. So for research in clinical medicine or epidemiology, I categorize them into 6 categories. And this is my own categories. You may not be able to find this in any textbook. So the first one will be research question regarding magnitude of health problems or clinical characteristics or practice patterns. Magnitude of health problems, clinical characteristics, practice patterns. The second group is research question regarding diagnosis. The third one, research question regarding efficacy of a preventive or therapeutic intervention. The fourth one, research question regarding prognosis or natural history of disease. What events will happen to patients with how much probability? The fifth one would be research question regarding etiology of disease, harms, or factors related to outcomes, such as risk factors, prognostic factors, preventive factors, or predictors. And the last one would be other question regarding association or correlation between variables. These categories are not mutually exclusive. Some particular research question can fit in more than one group, more than category. It depends on the viewpoint of the researcher. Why do we have to categorize research question into complicated groups? I will show to you later that it is useful because if you know the category of your research question, it will help you determine your research design. The study design that you will use will depend on the group, on the category of your research question. Yeah, different research question categories call for different study designs. So the first group, research question regarding magnitude of health problems, clinical characteristics, and practice patterns. For this type of research question, the component of research question will be only P and O. You will not have 4 components, you will have just 2 components, P, target population, and O, outcome. I'll give you example of research questions in this group. What is the prevalence and infection fatality rate of SARS-CoV-2 infection in Thailand in 2021? It's the question regarding the magnitude of health problems represented by prevalence and case fatality rate. There is no hypothesis to test, just want to know the fact, what the fact is. There are just 2 components, P, target population of Thailand in the year 2021. O, outcome, SARS-CoV-2 infection, the COVID-19 disease. What are the clinical features of sympathetic ophthalmia? Okay, this is a disease, a condition, a disease. What are clinical features? How is this disease presented? What characteristics? So it's the clinical characteristics of disease. For example, this disease might affect male more than female, might affect the elderly. It might present with blindness or whatever. So they are just P and O. Target population, patients with this disease, sympathetic ophthalmia. Outcome is now clinical features. Okay, the second group, research questions regarding diagnosis. This might be the research regarding properties of a diagnostic test. Is a test, what is the accuracy of a test in order to make a clinical diagnosis? The components of research question are P, target population, I, intervention, O, outcome. For C, there might be or there might not be C. It depends on how many tests that you are studying. If you are studying just one test, this particular test that you are interested in, you would like to study its diagnostic properties, then you will have just P, I, and O, no C. Target population, I is the test, O is the disease that you want to diagnose. But if you are comparing 2 tests for the same diagnosis, then one will be I and then one will be C. And you will consider psi and C together here. And for research question regarding diagnosis, there are 2 aspects. The validity of the test, how good the test is in making correct diagnosis. And it might be a question regarding reliability of the test, whether the test is reliable in terms of its interpretations. So for validity research question like this, what is the accuracy of non-mydriatic fundus photography performed by well-trained paramedic personnel in screening for diabetic retinopathy? This is the research question regarding diagnostic test. What is the test? The blue one, non-mydriatic fundus photography performed by paramedic, not the ophthalmologist. So this is the test to diagnose what disease? To diagnose diabetic retinopathy. Yeah, so you have the I and O here. In this sentence, you will not see the P, but you can imply what the target population is. For example, for people with diabetes. And about reliability of the test, whether the test result is constant when measured in the same situation in the same subject. For example, what is the inter-observer reliability among experienced and inexperienced anesthesia personnel in preoperative airway assessment? Here, the test is preoperative airway assessment, clinical assessment performed by anesthetist, anesthesia personnel. But comparing the experienced one with the inexperienced one, whether it's reliable or not. If it's reliable, if this type of assessment is reliable, then it doesn't matter whether the personnel has experience or does not have experience. They will assess patients the same way, the same result. But if this test is not reliable, then it might depend on the experience of the assessor. Another aspect of diagnosis may be regarding the clinical efficacy of a diagnostic strategy. Does performing a test lead to better health outcomes? And for this type of research question, you will not regard it as a diagnostic research question. You will regard it as a question regarding efficacy of an intervention, which is the category 3, the next one. And the component will be all 4 components. For example, in adults at risk of colorectal cancer, does screening colonoscopy every 5 years reduce colorectal cancer mortality compared to no screening? You'll see that it's the study regarding the test, colonoscopy, screening colonoscopy, but we are looking at the outcome, not the diagnosis of the disease, but the mortality, the result of being diagnosed and then being treated. So we will regard this type of question as the efficacy or effectiveness of intervention. Here, intervention is diagnostic strategy, comparing between screening versus no screening. So it fits in with this group, efficacy of a preventive and therapeutic intervention. And for this category of research question, we will have all 4 components, PICO. For example, what are the clinical outcomes of laparoscopic surgery as compared to open surgery after insertion of self-expandable metallic stents in acute malignant colorectal obstruction? A complicated research question, but they have all 4 components. Target population, patients with acute malignant colorectal obstruction treated initially with self-expandable metallic stents. So this is the target population. Intervention, the new treatment, laparoscopic surgery versus control, the old one, open surgery. Regarding the outcome, clinical outcomes, it is not specified here what clinical outcomes mean. It still needs more details, what outcomes that the researcher is interested in. But here I use it just as the example of research question in this group. Efficacy of laparoscopic surgery compared to open surgery in this population. Does misoprostol affect the pharmacokinetics of sustained release diclofenac in healthy adults? Okay, here again, target population, healthy adults. Intervention is misoprostol, a new drug. Compared to what? Compared to no misoprostol, it's not here in the sentence, but what the outcome that the researcher is interested in, outcome is pharmacokinetics, properties of sustained release diclofenac. Sorry, sustained release diclofenac is the comparator, so it should be green here, diclofenac, sustained release diclofenac. So comparing pharmacokinetics properties of misoprostol to sustained release diclofenac. Another example. Is intralesional botulinum toxin A injection effective in improving severity of alopecia tool score, SALT score, in patients with recalcitrant alopecia totalis or alopecia universalis. So here is the efficacy of treatment. Treatment is intralesional botulinum toxin A injection compared to control no injection. In what population? Patients with this disease, alopecia totalis or alopecia universalis. Does tailor-made polyethylene start improve hearing in patients undergoing total stapedectomy? So target population, patients undergoing total stapedectomy, a type of surgery in the ear. Intervention, the new treatment, tailor-made polyethylene strut. Outcome, hearing, whether this treatment improve hearing. So these are examples of this group. The fourth group, research questions regarding prognosis or natural history of disease. What events will happen to patients with how much probability? This group is similar to the group one in that it's the states of nature, the question regarding the states of nature. So the component will be just P and O, two components, similar to the first category. What are the long-term renal outcomes in children with idiopathic nephrotic syndrome? No hypothesis to test, just want to know the fact. Target population, children with idiopathic nephrotic syndrome. Outcome, long-term renal outcomes. Need more clarification what outcome, what these outcomes are. What are the outcomes of radioactive iodine ablation or treatment in pathologically defined low risk of recurrence, well-differentiated thyroid carcinoma patients? Just two components, target population, patients with this disease, well-differentiated thyroid carcinoma with pathologically defined low risk, so it's low risk patients. And the outcome of radioactive iodine ablation. So patients receive ablation, what are their outcomes in the long term? This particular question may be viewed as efficacy of intervention. If there is a control group comparing ablation versus no ablation, then it will convert this question into the third category. The fifth one, question regarding the etiology or harms or factors related to outcome. For example, are life assets related to teenage pregnancy? This is a very short research question, and it may be difficult initially to determine which category it belongs. But if you consider it carefully, you can say that it's the factors related to outcome. So there is no P here, but it's talking about teenage pregnancy, so P must be teenager. Intervention, life assets, still need clarification. What does life assets mean? Outcome is teenage pregnancy. And here I and C will be considered together, life assets compared to no life assets. Does topiramate, an epileptic drug, have teratogenic effects in chick embryos? This is not in human, but in chick embryo. But we can apply the same principle. Target population is chick embryos. Intervention and control INC is topiramate. And outcome is teratogenic effect. What factors are associated with birth trauma? Factors related to outcome. No P appear here, but we can imply easily because we are talking about birth trauma. So target population would be newborn baby, right? Intervention is factors which needs clarification, which factor that the researcher are considering, I and C, but outcome is birth trauma. And the last one is the basket that for any research question that cannot be categorized in the previous 5 categories, it will fit in for this last category. Component will be P and I or C or O. There might be just 1 or 2 or 3 components here. For example, does post-void residual urine volume assessed by portable 3D ultrasound correlate with that assessed by urinary catheterization? So here, researcher is studying correlation between residual volume assessed by 3D ultrasound, compare it to the true urine volume obtained by urinary catheterization. So it's the association between this and this. You may view this as a diagnostic study. You may think that portable 3D ultrasound is a test to measure urine volume compared to the gold standard, is urine catheterization. That is another view. Are there correlations between cervical length, cervical volume, and cervical vascularization as assessed by 3D power Doppler ultrasound during 18 to 40 weeks of gestation? Correlation between length, volume, and vascularization. So it's association correlation that does not fit in any of the previous 5 categories. Okay, so I have explained to you the 6 common categories of clinical research in the field of health science. Now, when you have a research project, we are talking about research question. You may wonder whether there can be many research questions in a research project. Actually, yes, there can be many questions for a research project. And usually there are many questions in a research project. When you develop a research project, it's very usual that you will have more than one question. For example, a research project regarding pulmonary tuberculosis in healthcare workers. There might be many questions. For example, the researcher would like to know what is the prevalence of pulmonary tuberculosis among healthcare workers. You would like to know the magnitude of the problem. They might also want to know various work-related factors associated with pulmonary tuberculosis in healthcare workers. They would like to know factors related to outcome, factors related to disease, risk factors of pulmonary tuberculosis among healthcare workers. And they also might want to know what are the outcomes of treatment in healthcare workers diagnosed with pulmonary tuberculosis. So there are at least 3 questions for this one research project. So it is common for a research project to have more than one research question. But if you have more than one research question, what you need to do is that you have to select 1 or 2 of them and designate it or them as your primary research question. And the rest will be secondary research question. So you can have more than one research question. You can have 2 or more. But if you have 2 or more research questions, you need to specify which one is the primary one, the most important one for you. And the rest will be classified as secondary research question. Primary research question is the most important question that the study aims to answer. It's the primary focus of the research. The answer is intended to be and can be conclusive for the primary research question. And it's this primary research question that dictates the design and conduct of research. Secondary research question, they are less important. The answer can only be viewed as hypothesis generation. You can make any conclusive answer regarding secondary research question. Very important, if you have secondary research questions, they must not compromise the ability of your research to answer the primary research question. If you have too many secondary research questions that it compromises the quality of research, then you will not get a valid answer to the primary research question. It will be better to drop off all those secondary research questions, ignore them all, focus just on the primary research question. Okay, so you can have more than one research question in your research project. If so, you need to specify which one is your primary research question. Now you might ask, can I have more than one primary research question? Can I have two primary research questions? The answer is yes, you can have more than one primary research question. But if you do, it will complicate your study design. It will complicate your research. So most research has only one primary research question to avoid complexity of design and analysis. But if you have more than one question that they are equally important to you, you would like to know the answer for all of them, you have more than one primary research question. If you have more than one primary research question, you need to design your study to ensure that it can provide valid answers to all of your primary research questions. And your research will be more complicated than having just one primary research question. And importantly, your more than one primary research questions, they must not conflict with each other. Because if they do, then you cannot conduct your research. You need to split them into two separate research projects if they conflict to one another. And conflict here, for example, if you have two primary research questions and each of them requires different research design, they conflict with each other, then it will be better to split them off to two research projects, and each one will have just one primary research question. It is better to provide quality answers to a small number of questions than to provide inferior information in volume. Again, I emphasize that if you have many questions, be aware that the secondary research questions, the process of answering secondary research questions must not compromise the quality of your research to answer the primary research question. Okay. Next topic will be developing proper research question. We have already discussed about research question, how important it is. Now, how can we develop a research question? So there are some considerations before you can develop a research question. You have to have basic dimensions of the problems. You need to have some basic knowledge about that topic. You need to review literature in details. You need to know about biology, physiology, epidemiology, management, and outcomes. You have to know that topic in details to identify knowledge gap. And this knowledge gap will lead to your research question. But to get a research question, you also need to consider about plausibility and feasibility of the design of the study, potential members of research team and their cooperation, and resources, essential resources need for conducting research. So it's not just getting a research question, you need to consider the follow process. A good research question has some characteristics. A good research question should fit in this acronym FINER. So there should be 5 characteristics for a good research question. Feasible, interesting, novel, ethical, and relevant. And for feasible, the question must be feasible in order to answer it with research. You should have adequate number of subjects. You should have technical expertise required to conduct the research. You should have enough time and money. The scope of the study must not be too broad for you. So this is the consideration of feasibility of a research question, whether you will develop it into a research project. It must be interesting. This is very basic. If your question is not interesting, then it might not worth answering it, right? So it must be interesting, not just for you, but for all the scientific community. It will be the question that when you present to other people, and they will say, wow, this is interesting. Wow, this is interesting. It must be novel. Research will provide some newness, new knowledge. So it must be novel, provide new findings, new knowledge, or at least confirm or refute or extended previous findings. It must be ethical in terms of physical risk and invasion of privacy in doing research. And lastly, it must be relevant to advance scientific knowledge. It must influence practice and policy and guide further research. So this is the characteristic that you can consider whether a research question is good or not. Now, where can you find your research question? This is difficult. Although formal rules and procedures exist to guide the development of the research design, data collection, protocol, and statistical approach, there are few, if any, guidelines for conceptualizing or identifying research questions, which may take years of thought and exploration to define. So I cannot give you the exact answer, where can you find your research question, but there are some advice from experts. The origins of research question most spring from intellectual curiosity of the investigators and are shaped by his or her critical reasoning skills, experience, and environment. This is a concept, but in practice, where can you get your research question? I will give you some examples. Unresolved, uncertain practical issues faced in day-to-day work. In your day-to-day work, you may face some problem repeatedly, and you don't know the answer. That could be the origin of your research question. Your research question might be originated from observation collected in conjunction with medical procedures. When you perform new procedures, you may have some question, whether it's better than the old one. Is it good? For example, that would be the origin of your research question. Many questions originated from published literature. When you review literature, you may find, you may see findings that is not usual. You may see some findings that contradict with the existing theory that would originate into your research question. Or you can find that many studies looking at the same thing did not provide the same results. It's unresolved discrepancy between studies that could be the origin of your research question. Or in some situation, you may review literature and then you find that there are just few research regarding that topic. And that would be the origin of your research question. General paucity of quality data on a significant topic. A research question can originate from policies of government or funding agencies. For example, if the government consider that people are aging, the country is going into aging society. So aging is important, and the government want to give funding for research regarding aging. And that would be the origin of your research question. Specific request in a particular area of interest by the government or funding agency. And interchange of ideas in conference seminars. When you attend conference, attend seminars, you hear ideas from other researchers, you discuss with other researchers, you may have some new idea about research question. So these are just examples of where you can get your research question, but eventually it will depend on your background and your curiosity, your personality, your skills of acquiring some information. So a research question will be a good research question. It has to pass this barrier. So what? So if you have a question that you think it might be a good research question, discuss it with your peer, present it with other, and see the response. If the response is, so what? And you cannot answer this, so what? Your question is not good enough. If your question is good, when you present it to people and they ask you, so what? You can explain it. Why? Why do you need to do research? Why is it important? Then it will be a good research. Okay, so before we reach the end of the talk, defining a proper research question is a prerequisite for any research. Research begins with research question. It is the most important steps in the whole research process. Formulation of a research question is often more essential than its solution. Question is more important than answer. The process of defining a research question must in no case be accomplished hurriedly. Take time. Do spend time on it. Don't worry about the time, because when you get a good question one, then the rest of the process will be easy and fast. Okay, I think I will skip this one, the overview of study design, for the sake of time. I don't have time for this, but you will learn about various study designs in subsequent topics in this course. I just want to show you the last slide regarding research question category and study design. Why do we have to categorize our research question? Because it will dictate your study design, your appropriate design. If you have research question regarding magnitude of health problems or clinical characteristic or practice pattern, group 1, the most appropriate design would be cohort study, descriptive cohort, or descriptive cross-sectional study. If you have question regarding diagnosis, the most appropriate design would be cross-sectional diagnostic study. Question regarding efficacy of a preventive and therapeutic intervention. Most appropriate design would be experiment, randomized control clinical trial. Question regarding prognosis or natural history of disease. Most appropriate design would be, cohort descriptive. Question regarding etiology, harms, factors related to outcomes. Most appropriate designs would be cohort analytical or case control or cross-sectional analytical. And last one, questions regarding other association or correlation. Similar to the fifth group, most appropriate cohort can be either cohort analytical, case control, or cross-sectional analytical. Okay, we have already run out of time, but if you have a very important question, I can answer you one or two questions. Do you have any question? Okay, if you have question later, you would like to contact me, you can contact me through this email. And also I will have assignment for you. and you get marks from assignment, and it contributes to your grade. I will distribute assignment to you through the coordinator of the course. I will give you details about assignment and the due date later. And when you submit your assignment, you can submit your assignment to me through this email.